How's it going, everyone? It's Alex from Chandler Physical Therapy. Today we're going to go over 3 different techniques with the Kinesiotape to help with tight wrist flexors, extensors, and the bicep. Super important that you are aware of how the tape should go to create this inhibition. So it's really important for you to know anatomy, knowing how the muscle pulls. So if the muscle starts up here, ends here, it's going to contract and pull. We're going to try to fight that contraction by putting and starting the tape distally and going proximal. Really important that you want to clean the skin, make sure it's free of any oils, dirt. The tape can last anywhere from 3 to 5 days. If you do have some oil, it's not going to last as long, so it's just trying to get the biggest bang for your buck. So I'm going to clean the area with some rubbing alcohol. You can do the same with hand sanitizer. We'll clean this bicep since we're going to show you how to tape that, and his extensors. While that dries, I'm going to measure the tape. The tape is elastic, so we want to be aware of how much pull we want to create with the tape. To inhibit, I want to go under what I call moderate tape tension. So I'm going to, about 3/4 of the way up, I'm going to do my first cut. I'll measure the extensors, about the same rule, 3/4 of the way up. And we're gonna measure the bicep. One thing I do like to avoid is taping over the joint itself. It just becomes a little bit more irritating if it goes over the joint. Now, sometimes you wanna tape around the joint for stability. That it's just being aware of ultimately what you want to do with the tape. What I like to do is I like to round the edges. The reason why is if you have a sharp corner, it's just gonna get caught in something and it's gonna roll up faster. So this is just kind of prolonging the tape. I tell patients that if the tape feels pretty good and you like it and it starts to roll up, you can trim it to help it last a little bit longer. If the tape is uncomfortable, itchy, you don't like it, you can take it off right away, warm soapy water or baby oil. All right, so like we said, we're gonna try to inhibit, create a stretch. So I'm gonna have him go into a wrist flexor stretch. It's super important for him to keep the elbow straight if he can. There we go. Now I'm gonna get my anchor. The tape is always gonna try to recoil to your anchor. The anchor is where you have no tension. Now, I'm going to create a moderate amount of tension, and I'm going to bring it up. So, if I put the piece that I cut, as you can see, it's stretched. Maybe around 25% of what it was. Now, if we wanted to incorporate more surface area, we can always cut the tape and fan it out, or we can put more strips on top. The one thing you do want to avoid is putting tape directly over tape. You want at least half the tape to be on skin because it's activated by body heat. Okay, so now we're going to move on to the extensors. So now I'm going to have them go into an extensor stretch. And again, we're going to get an anchor. We're going to place it. We're going to avoid the joint if we can. And now we're going to stretch it out. And again, if you want for this one, you can go all the way to the joint or a little bit above the joint. It's not going to be at that crease, at that joint line. And again, we're going to pat it down, try to get it. And if we wanted to, again, we can always add another piece or cut it to create more surface area. Now for the bicep. Again, for the bicep, we're going to try to create a stretch. For that, we're just going to have them go into elbow extension. Again, we're going to create that stretch and lay it down. Same thing. Want to create more surface area, we can cut 2 pieces or even into 3 pieces, fan it out. When you do that, you're going to lose the power of the elasticity, but you'll gain more surface area just depending on what ultimately you want to do. Now, you can relax. with the tape, if you cut or tear through and just let it relax, it's pretty dark, you can't see it. I tell people once you pull it apart and you can start seeing through that, that's about moderate stretch, 50%, and then it can stretch 100%. When you do that 100%, you're not going to have any elasticity. It's going to be mostly for support or stability. So it's super important for you to know ultimately your goal of the tape. If it's either to facilitate, to help the muscle contract, inhibit, to help it relax and create a stretch, create a space correction to help with drainage, or even to promote stability. There's a couple different ways you can promote stability and help activate muscles. It's just being aware of the muscle, where it starts, the origin, and the insertion where it ends, and how much force you want to create by it. All right, if you guys have any questions, contact us. You always want to contact a medical specialist or get some consult before you should try this. I know there are different brands out there you can buy over the counter, but always please contact someone who knows some knowledge behind the tape or medical knowledge. All right, have a great day.